Thank you, Mr. Chair. Minister, you're a mom, I'm a mom, and recently in BC, protocols have been put in place to allow so-called safe supply of fentanyl to kids under 18 without parental consent or knowledge. My question is simple. Have you met with the Prime Minister to put a stop to this?
I think the more important question is to meet with the experts who are involved in the prescriber intervention models that you discussed, because they are truly the experts in this field, which is something that we have done. And like yourself, I am a mother.
Minister, have you met with the Prime Minister, yes or no?
I meet with the Prime Minister regularly.
Have you met with the Prime Minister to discuss fentanyl to children under 18 and putting an end to it, yes or no?
The question should be asked is meeting with experts and physicians who are responsible for prescriber models to their patients. Medical practitioners
okay with children under 18 getting fentanyl.
The question
prescribed.
was whether or not I met with the Prime Minister. That was not,
okay.
The question was not
then
whether or not.
Are you okay with children under 18 being prescribed fentanyl, yes or no?
I am comfortable with medical practitioners meeting with their patients.
Okay, thank you, Minister.
What is best for their patients.
On September 26th, in question period, you said decriminalization was the first step. What's the second step?
Harm reduction. There is prevention. There is harm reduction.
Okay,
there
thank
is
you.
treatment and recovery.
So have you had any conversations about legalizing drugs like heroin, cocaine, and meth?
The decriminalization program is not about legalizing illicit drugs. The decriminalization program pilot project that was requested by the BC government is about reducing stigma, those who are in personal possession, to be able to access medical services and interventions.
So what is your stance on publicly traded companies like Safe Supply Streaming Company and Lucy Scientific, who are selling stock based on what they seem to predict as a legal market in Canada for drugs like heroin, cocaine, and meth?
I don't work in hypotheticals. I work in the realities of this moment.
This is the
realities of this moment are that the interventions that we work with the BC government and with many jurisdictions across the country based on prescriber-based interventions. If the market wishes to speculate, that is the market's choice.
Minister.
We are fully committed to
Please.
a prescriber model.
Go ahead, Ms. Goodrich.
So are you committed to no more legalization of hard drugs in Canada?
We have not legalized hard drugs.
Will you? You have. You legalized marijuana since forming government in the last 8 years. My question becomes, are you looking to legalize more drugs, yes or no?
We have not legalized illicit drugs.
Okay. So, Minister, I know we've had conversations.
Chair, do I have another moment to answer on that?
No.
Okay, thank you.
Go ahead, Ms. Goodrich.
What my colleague was trying to show earlier with the fact that a few grams could kill somebody with fentanyl, and yet you've allowed a decriminalization pilot project to allow up to 2.5 grams, which most Canadians aren't familiar with grams because we don't do our baking or our measuring in grams. It's a lot. It's a lot more than a couple grams. And so it's terrifying that we are allowing people to just have free will on this. When I asked your predecessor at committee, what would it take to stop the decriminalization pilot project, this experiment on our society? She said very clearly, both on the public health indicators and the public safety indicators. What we're seeing is out-of-control crime and chaos on our streets and increase in overdose deaths. And yet you very clearly said that you are A-OK continuing on with this decriminalization pilot project. Is there anything that could happen that would make you stop?
Okay. Now, Minister, you have a full minute without being interrupted. Go ahead.
Thank you, Chair. So I'll start by saying the 3-year pilot exemption that was asked for by the BC government was put forward after extensive consultation, including of the amount of 2.5 cumulative threshold. And I would note that not while it was approved by Health Canada, it was supported in full by the Canadian Association of Chiefs of Police. So this wasn't done without consultation. It wasn't done without careful consideration. But I would also note the composition of the drug supply at this time is changing. It's deadly, and the substances that are in it are frequently unknown even to those who use them. So to posit that it's specifically one drug in that 2.5 is really not facing the reality of what's on the streets that is so deadly to those who are using them.
Thank you, Minister, and thank you, Ms. Goodridge.